Welcome to Breaking Down Mental Health with Dr. Jones. In these educational videos, Dr. Jones will discuss mental health diagnosis, clinical supervision, using technology in counseling, multiculturalism, and many other topics to help you get a healthy understanding of why mental health is important. Please don't forget to like, subscribe, and hit the notification button if you enjoy these videos.
Welcome to the Deep Dive. Today we're getting into a topic that's really fundamental for anyone running a private practice. It's about hiring. Specifically, that decision between bringing people on as W-2 employees or as 1099 independent contractors.
Yeah, it's a really common question, and honestly, it's got layers. It's not just business logistics. There are significant legal and, importantly, ethical dimensions.
Exactly. And to help us navigate this, we're leaning heavily on the work of Dr. Michael Jones. He's a PhD, LPCS, NCC, BCTMH, quite the list of credentials.
He really is. A counselor, educator, licensed professional counselor, supervisor, board certified in telemental health. His perspective is invaluable here.
Absolutely. So this whole deep dive is anchored in his article, Independent Contractors in Private Practice, Ethical Viewpoints and Implications.
A great resource.
We're going to sort of unpack the ethical decision-making side that Dr. Jones talks about. Look at the IRS legal viewpoints, which are critical potential conflicts.
Right.
And just generally the key ethical things you need to keep front of mind. The aim here is really to bring some clarity for anyone facing this hiring choice.
And Dr. Jones really stresses, not just going with your gut feeling on this.
Good point.
He points to the ACA Code of Ethics, Standard I.1b, which actually guides us to use a formal ethical decision-making model when we hit these kinds of dilemmas.
Okay, so he's advocating for structure. You mentioned a model, Forrester, Miller, and Davis.
That's the one he references, yes, a 7-step model. And applying it here, the initial problem, the core issue Dr. Jones identifies, is pretty clear.
Which is?
Well, you've got these two types of workers, W-2s and 1099s. They might be doing very similar work, like providing therapy in your practice.
Right, offering similar services.
Exactly. But legally, they're classified completely differently. And Dr. Jones argues that difference is where all the legal and ethical complexities really start.
Got it. And a huge piece of that legal puzzle, according to Dr. Jones, comes down to the IRS, how they decide who's who.
Definitely. He pulls right from irs.gov, highlighting 3 main factors they use for classification. The first one is behavioral control.
Okay, behavioral control. What does that actually mean in, like, a counseling practice context based on Dr. Jones's analysis?
So drawing from the IRS definition, Dr. Jones explains it's about whether the business has the right to direct and control how the work gets done, even if you don't actively micromanage every day.
The right to control, not necessarily the constant exercise of it.
Precisely. And Dr. Jones gives some really concrete examples for counseling practices where this gets, potentially problematic if you're classifying someone as 1099.
Like what?
Things like setting rigid schedules for therapists, requiring them to attend staff meetings, giving very specific instructions on, say, treatment methods or documentation.
Performance reviews, too.
Yes, performance evaluations, mandating specific training provided by the practice. All these things, Dr. Jones points out, lean heavily towards suggesting an employer-employee relationship in the eyes of the IRS.
That makes a lot of sense. He uses that plumber analogy, right?
He does, yeah. It's helpful.
You wouldn't tell a plumber you hired for a job exactly when to show up within a broad window or which specific wrench to use. You hire them for the result.
Exactly. That lack of detailed control over the how is characteristic of an independent contractor relationship. It's very different, as Dr. Jones notes, from integrating someone into the daily operations of your practice.
Okay, so behavioral control is key. What's the second factor Dr. Jones highlights from the IRS?
Financial control. This one's about the business's right to control the economic side of the worker's job.
Right, the money and resources aspect.
Yeah.
How does Dr. Jones see this playing out in private practices?
Well, he points out common scenarios, like practices providing computers, paying for EHR system access,
Electronic health records, yeah.
office furniture, maybe even covering certain supplies. And crucially, asking contractors to sign non-compete agreements.
Non-competes.
Yeah.
That feels like financial control.
It can be interpreted that way, yes. According to Dr. Jones's reading of the IRS guidelines, these things suggest the business is controlling the financial framework. A truly independent contractor, as he emphasizes, typically invests in their own tools, their own systems.
Like the plumber bringing their own tool.
Yes, exactly. And they have the freedom to seek work elsewhere, not be restricted by a non-compete from the business they're contracting with. That financial independence is a marker.
Okay, behavioral, financial.
Yeah.
What's the third IRS factor Dr. Jones discusses?
The third one is about the nature of the relationship itself, how the worker and the business perceive their arrangement.
Perception. Okay. How does the IRS gauge that?
A big piece of it is permanency. Dr. Jones highlights that if the working relationship looks like it's ongoing, indefinite.
Like no specific end date.
Right. That strongly suggests an employee relationship, regardless of whether you offer typical benefits like health insurance or paid time off. Independent contractors are usually brought in for specific projects or defined periods.
So if a therapist has been working steadily at your practice for years, even if they're called a 1099, the IRS might see that differently.
That's a definite risk, yes. And Dr. Jones adds another layer from the IRS perspective. If the services the worker provides are central, like key to the business's main activity.
Which therapy definitely is for a counseling practice.
Absolutely. The IRS is more likely to see that as an employee relationship because the business inherently has a strong interest in controlling how those core services are delivered.
Okay, so understanding these IRS factors is critical legally, as Dr. Jones makes really clear. But he doesn't stop there. He brings it back to ethics using the ACA code. Let's talk about client autonomy standard A2A.
Yes, this is a major ethical consideration Dr. Jones flags. Standard A2A is all about informed consent, which includes the client's right to choose their provider, their autonomy in their care decisions.
And how does that connect to the 1099 issue?
Dr. Jones draws a direct line to what happens when an independent contractor leaves a practice, especially if there's a non-compete clause involved.
Ah, right, the non-compete again.
Yeah. If that clause prevents or hinders a client from following their therapist who they chose and built a relationship with it, potentially infringes on that client's autonomy, their right to choose.
Because the client's relationship is with the therapist, not necessarily the practice itself.
That's the core ethical argument Dr. Jones presents. Clients have the right to continue with their chosen provider if they wish, even if that provider, formerly a contractor, moves elsewhere. The practice structure shouldn't override that fundamental client right.
And Dr. Jones also clarifies something about soliciting clients in this scenario, right? Standard C3D.
Yes, he addresses that. Standard C3D is about prohibiting the solicitation of clients by departing employees. Dr. Jones argues it doesn't generally apply when a former independent contractor's clients choose, of their own volition, to follow them.
Because they weren't an employee in the first place.
Exactly. It's the client exercising their autonomy, not the former contractor improperly soliciting while still employed, which is what that standard aims to prevent.
This is complex. It feels like weaving through all of this, the IRS rules, the ethical standards, is this recurring theme Dr. Jones brings up. Control.
Absolutely, you've nailed it. Dr. Jones essentially concludes that the decision between W-2 and 1099 really hinges on how much control, behavioral, financial, relational you, as the practice owner, are genuinely willing to give up.
So if you're comfortable with a clinician having a lot of independence, setting their own hours, using their own methods, maybe working elsewhere too,
then the independent contractor model might align, provided you structure it carefully to respect those IRS guidelines and ethical boundaries, particularly around client choice.
But, and this seems to be a big but in Dr. Jones's view, if you need more oversight, more integration, shared resources, a consistent team approach,
then hiring W-2 employees is likely the more appropriate and ethically clearer path. Dr. Jones suggests that while it means taking on more employee responsibilities, payroll taxes, potential benefits, supervision duties... More admin, definitely. But it provides clarity. It aligns the legal classification with the reality of the working relationship and avoids the ethical tangles and legal risks associated with misclassification.
So it might seem easier or cheaper up front to go the 1099 route, but Dr. Jones warns that might be overlooking significant long-term risks and ethical responsibilities.
That's a fair summary of his position, yes. The clarity and reduced risk associated with proper W-2 classification often outweigh the perceived initial benefits of the 1099 model, especially when control is desired.
Okay. As we wrap up this deep dive based on Dr. Jones's insights, it's really clear this isn't a simple administrative choice. W-2 versus 1099 in private practice has these deep ethical roots and serious legal branches.
Absolutely. It demands, as Dr. Jones advocates, that structured ethical thinking, really understanding those IRS tests, and always keeping the client's rights, especially their autonomy, at the forefront.
So a good takeaway for you listening might be to really reflect, maybe using Dr. Jones's article as a guide. What level of control do you actually expect or need in your practice regarding scheduling, supervision, how integrated clinicians are?
How do those expectations truly line up with the definitions of an employee versus an independent contractor?
And maybe the most vital question, drawing from Dr. Jones, how can your business structure and hiring decisions consistently support ethical care and fully respect that crucial element of client autonomy?
These are the hard but necessary questions. And again, our thanks really go to Dr. Michael Jones, PhD, LPCS, NCC, BC, TMH, for his thorough work on this subject. His article gave us a fantastic roadmap for today's discussion.